Hi there, this is Nursing Education Videos. Today I will be reading Hypomagnesemia NCLEX review on registerednursern.com. All credit for this information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. Disclaimer from registerednursern.com. This video is for educational purposes only and is not intended as medical advice. While we strive for 100% accuracy, errors may occur and medications or protocols may change over time. Hypomagnesemia NCLEX review notes. Are you studying hypomagnesemia and need to know some mnemonics on how to remember the causes, signs and symptoms, and nursing interventions? This article will give you some clever mnemonics on how to remember hypomagnesemia for nursing lecture exams and NCLEX. In addition, you will learn how to differentiate hypomagnesemia from hypermagnesemia. Don't forget to take the hypomagnesemia and hypermagnesemia quiz. In this article, you will learn normal magnesium levels, causes of hypomagnesemia, signs and symptoms of hypomagnesemia, and nursing interventions for hypomagnesemia. So, what does hypomagnesemia mean? Hypo means under, magnese, prefix for magnesium, emia for blood. Meaning of hypomagnesemia is low levels of magnesium in the blood. Normal levels of magnesium is 1.6 to 2.6 milligrams per deciliter. Less than 1.6 is considered hypomagnesemia. Magnesium plays a role in major cell functions like transferring and storing energy, regulation of parathyroid hormone PTH, which also plays a role in calcium levels. In hypomagnesemia, the release of calcium is inhibited, and that is why you will see hypocalcemia if you have low magnesium levels. So I just wanted to double check that. So it is correct based on the information I found on Google. In hypomagnesemia, the release of calcium is inhibited, and that is why you will see hypocalcemia if you have low magnesium levels. Magnesium also plays a role in the metabolism of carbohydrates, lipids, and proteins, and blood pressure regulation. Magnesium is absorbed in the small intestine and excreted via the kidneys. Any issues with these systems can cause magnesium level issues. So causes of hypomagnesemia. Remember mnemonic low mag. L for limited intake magnesium. It could be due to starvation. O for other electrolyte issues which causes low magnesium levels, such as hypokalemia, which is a low potassium, and hypocalcemia, which is low calcium. Wasting of magnesium in the kidneys due to loop and thiazide diuretics and cyclosporin, which stimulates the kidneys to waste magnesium. Malabsorption issues due to Crohn's, celiac, proton pump inhibitor drugs, Prilosec, Nexium, Protonix, drug family ending in prazole, omeprazole, as well as diarrhea and vomiting. Alcohol. Due to poor dietary intake, alcohol stimulates the kidneys to excrete magnesium, as well as might cause acute pancreatitis. Glycemic issues, such as diabetic ketoacidosis, as well as insulin administration. Signs and symptoms of hypomagnesemia. Remember, mnemonic twitching. Because the body is experiencing neuromuscular excitability, this is the opposite in hypermagnesemia, where everything of the body, everything system of the body is lethargic. So T for churrosos, which is positive due to hypocalcemia. So churrosos is spelled Trouesseau. W for weakness. I for irritability. T for torsades de Pontes, or torsades de Pontes, abnormal heart rhythm that leads to sudden cardiac death, seen in alcoholism, as well as T for tetany, bracket seizures. C for cardiac changes, moderate loss, tall T waves, and depressed ST segments. So the moderate loss of magnesium would cause tall T waves and depressed ST segments. Severe loss of magnesium would be prolonged PR and QT intervals. Prolong of QT interval increases patient risk for torsades de Pontes with widening QRS complex, as well as flattened T waves. Chevostek's sign, which is positive, which goes along with hypocalcemia. H for hypertension, hyperreflexia. I for involuntary movements. N for nausea. G for GI issues with decreased bowel sounds and mobility. Nursing interventions for hypomagnesemia. Monitor cardiac, GI, respiratory, and neurostatus. Place patient on a cardiac monitor, watching for any EKG changes, such as prolonging of PR interval and widening of QRS complex. May administer potassium supplements due to hypokalemia, which is hard to get magnesium level up if potassium level is down. Administering calcium supplements. So oral calcium supplements with vitamin D or 10% calcium gluconate. Administer magnesium sulfate intravenous route. Monitor magnesium level closely because patient can become magnesium toxic. So magnesium toxic would be hypermagnesemia, I assume. Watch for depressed or loss of deep tendon reflexes. Place patient in seizure precautions. Oral forms of magnesium may cause diarrhea, which can increase magnesium loss, so watch out for this. Watch other electrolyte levels like calcium and potassium. Encourage foods rich in magnesium. Remember mnemonic, always get plenty of foods containing large numbers of magnesium. A for avocado, G for green leafy vegetables, P for peanut butter, potatoes, and pork, O for oatmeal, F for fish such as canned white tuna / mackerel, C for cauliflower and chocolate (dark), L for legumes, N for nuts, O for oranges, M for milk. And there are quizzes on magnesemia, quiz on hypomagnesemia versus hypermagnesemia. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button, and go to registerednursern.com for more information.